Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Ayada's Corner. We have a very special guest with us, Muna Muhammad. She was actually part of a conversation that we had back in May of 2020. This was at the peak of the pandemic and right around the time the social unrest was happening. And Muna joined us and shared some best practices around mental health. And we're so privileged to have her back again to talk about some of the things that still are relevant on how you can take care of your mental health, things to notice, and ways that we can start to put into practice in our day-to-day lives. So with that, I'm going to have Muna introduce herself. And before she introduces herself, I do want to say that last month we talked about substance abuse, and I think oftentimes people don't associate mental health and substance abuse, but here we need to realize that there's a connection, and how do we start to understand both respectively and together. So with that, Muna, I would love for you to introduce yourself and tell folks what you're up to now.
All right, well, thank you so much for having me and for Ayada. My name is Muna Muhammad. I am a licensed clinical professional counselor, and what that means basically just I can do therapy. So currently I own a private practice, and initially I started as an individual, thank you, and then I transitioned to a group private practice where I added more clinicians, and that happened during the pandemic. I was just facing a lot of referrals, which is a really good thing for a practice, but at the same time, I just felt slightly, helpless. I'm like, I can't really handle, everyone or help everyone. So I ended up, reaching out to colleagues and people that I worked with before and friends, and I asked them if they're interested in part-time, jobs. So I started with part-time therapist, then transitioned to having full-time therapist, and right now we're a total of 9 clinicians, including me, and we work with a lot of the individual people who come to us are, people from underserved and marginalized communities. Majority of them are on, state insurances. They come from different walks of life. So we feel really honored, that they, trust us with, their life and their, issues, and they feel that we have the proper, guidance to, help them reach a, better and fulfilling life.
So when we met last, this was like May 2020, people were uncertain about the state of the world, right? Mm-hmm. Everything shut down from schools to work, and a lot of the times our underserved communities don't have resources to actually put into practice, as I mentioned, things that they can actually do to better their mental health. Maybe it's because of stigma, maybe it's because of the cultural norms that they've been used to. So what have you seen change as it relates to mental health from when we first talked about it back in May and now?
I think the pandemic forced a lot of people to sort of face the reality of oh my God, mental health, exists, and mine is suffering right now because of just the pandemic, being quarantined, a lot of people losing loved ones during the pandemic, and combine that with the racial uprising that happened. So there are a lot of triggers for so many people, whether they had pre-existing, traumatic, experiences, or if someone had, acquired one during those times. I would say we're still really lacking in terms of culturally competent services, or even just, generally the amount of need that's out there, and the services that we have are not equivalent. There's such a shortage of therapists, such a shortage of mental health services out there, and if we want to focus more on the culturally competent ones, it's just very handful, it feels like. So yeah, I think we're really in dire need for more professionals in the field to help and assist people out there during those tough times. We are still in a pandemic, and it was really a traumatic, experience to go through. And right now, people are just adjusting, right, to living in this new norm. Right now, I have some relatives who also work in the school system, and then they tell me how the children are behaving. And of course, they're adjusting to transitioning from home to the school. So that adjustment, process can cause a lot of distress and, make the person you just feel so, under pressure, very overwhelmed. So when you hear individuals saying like, it's really hard to work, or it's really hard to complete, hard to complete my tasks. I just came back to the office and I'm having a difficult time, just like working like I used to work before. It's completely normal. It's, we went through something very abnormal, and it makes sense why we're still, going through this adjustment period.
Can you, at a basic level, if someone's watching this and they don't even know what mental health is and they don't understand, like, how do I know if my mental health is bad? Where do I start, like, going back to the basics? Like, how would you describe that to someone who's watching this for the first time and they're really trying to seek help, but they don't even know where to start?
Sure. So first, what is mental health, right? Like, mental health is basically just the well-being, the general well-being of your psychological, emotional, and social well-being. So if these aspects are suffering, then that means you should be seeking help. And it really looks different, from person to person. Like for you, for example, and for me, if we're both experiencing depressive symptoms, it might not look like, the same. But what we need to focus on is how are we functioning? How is our functionality? And it could, go from mild to moderate to severe sort of, distressors. So, an example that I can give you is I can do my job, but I'm under so much, stress, right? So I'm doing it with great difficulty, or I can't do it at all.
Yep.
So these are the moments where you need to seek help. You're able to do your daily tasks, or you're functioning, but you're doing it with great difficulty, or you can't really do it anymore. And everyone is noticing, and you're noticing that. So that's when I would say you'd need to seek professional help. And how to go about it, there are some resources out there. If you're looking for a therapist, one of the first places I would recommend is Psychology Today. You could just type in your zip code, and then it'll give you a list of therapists within your nearby. If you're going to school, college, look into the counseling clinic at your school, and see if they have any openings. If you have a primary care doctor, you could just ask them for a referral to a therapist, maybe within the clinic that you're going to at the moment.
Okay, yeah. That's really practical. I appreciate that. And I think you mentioned something about the different symptoms show up differently for folks. How would you say, like, if someone knows, okay, my mental health isn't good, how would they maintain that? Let's say they don't want to get help and they just want to do their own maybe self-care. Each person has different self-care styles. Is there alternative ways if they don't want to seek help to actually start to improve their mental health themselves? Depending on, I guess, the severity, it's probably where to start.
Yeah, I would say it depends on the severity. Sometimes you really don't have a choice, right? And then you might, end up to like at a point where you really, really want to seek help. I hear that often, where people are like, really avoiding coming to therapy. I've done everything, but now I'm like, I feel helpless. I don't know what to do anymore. But if you want to talk about the, self-care, like what can you do? Even if you are seeing a professional, you still need to practice and engage in self-care on a regular basis. I would say just start from whatever brings you joy, and helps you recenter yourself. Because oftentimes when we're not, at our best, we feel very scattered internally. So what grounds you, what centers you, just find that and make it into. You take small steps into making it into like a habit, whether that is reading or meditating or just moving your body. They're very simple and practical. I think a lot of people might be fooled by just like those fancy self-care, right? Examples of like, I went on a vacation, I went to a resort. No, it doesn't have to be expensive, because we do recognize that not everyone has access to similar resources. So just within your means, what can you do that at the same time can bring you joy?
Yeah. You covered this a bit, but what are the major warning signs when your mental health is declining? You talked about productivity being a key indicator, but are there other signs that people should look for that they might be missing to actually know that, okay, this is, my mental health is actually declining, either I need to get help or I need to up my self-care?
Sure. Yeah, so I would say generally, as I mentioned before, functioning from, like different domains like school, home, social life, friendship life. So if you're, for example, isolating more, or the things that you used to do, you don't do anymore because you don't enjoy doing them, or you're incapable of doing them anymore. Your concentration isn't, really there. Your sleep is being affected, right? Your eating is being affected, whether if you're eating too much or eating too little. You're skipping work maybe a lot, or not completing your homework. So I was just like, from these different domains, are they, suffering as well? Then that means there's something happening with you that's preventing you from, performing or being the person. So you're not at your baseline.
Thank you so much for sharing this space with us and, sharing your wealth of knowledge with everyone watching. To wrap up this discussion, what's one thing that you would leave our viewers with, just like some parting words for them to just think through mental health and how they can start to actually take all of this information you've shared and put it into practice?
Yeah, one thing is just reinforcing the importance of mental health, and really, if you're not mentally healthy, then you're really not healthy, right? It's, mental health is the health of everything. So prioritize that, and don't hesitate to seek help. I know there's a lot of stigma when it comes to seeking help. Like, it might mean that I'm weak, or like I'm a failure, and and all of the negative self-talk that we might engage in. So I was just like, get the help that you need once you recognize it, and put your mental health first. Yeah.
Well, there you have it. We are now closing out our conversation for the month. May you take the nuggets of gems that Mona has shared and start to put it into your life, and we hope that you join us for our next discussion. Assalamu alaikum wa rahmatullah, and have a wonderful day. Bye, everyone.
Thank you.